Though the health sector is experiencing a myriad of challenges with a looming nurses' strike, there is still much more to be emulated by other African countries.
What we have just again presented to Parliament and to the Cabinet sessional paper establishing 22 referral facilities in Kenya, which will be open to universities to use for teaching and research. And once they develop fully as referral facilities, they will give a lot of service to the region.
The Congolese delegation, led by the Director General of Health, Dr. Alan Pasco, is mainly focusing on the private and public sector partnership, as well as the inspections system in the Kenyan health sector, with a view to replicate relevant lessons back in Congo.
So they're looking at the new policies that are going through Parliament, the regulatory structures that are in place to bring quality in the medical board, nursing board, laboratory board, and so on, because some countries don't have these boards, and we've had them for many years and we're still reforming them.
One of the major achievements in the Kenyan health sector, as noted by Anyang' Nyong'o, is the provision of skilled labor.
Now, if you are going to train high-level manpower in health services, and others also give services to the people, it's very important to develop these referral facilities. They are going to have an extremely important impact in the health services delivered in our nation.
According to Dr. Kamarogo, the lead health specialist in health in Africa under the World Bank Group, Africa is faced by more or less similar challenges in the health sector, and sharing experiences will help improve the situation.
They are in a francophone system, we're in an anglophone system. And these colonial systems are very, very different in the way they run their health sector. So we are beginning to bring Africa together and say that language should not be a barrier because diseases are the same, the challenges are the same. So what can we learn from the anglophone system or francophone system, and what can they learn from us? So this is the reason why they are here, to see what is happening. They are not looking for perfection, but they are looking for lessons, the roadmap and lessons, so that they don't repeat the same mistakes.
Health Minister Professor Anyang' Nyong'o, however, declined to comment on the looming nurses' strike.
Mimi najua ya kwamba kuna fununu hapa Kenya ya kwamba kuna magomo, lakini kwa leo hebu tuendelee na mambo yanayohusika na wageni. Tafadhali.
Health in Africa, through the support of IFC and World Bank, hopes to assist African governments make full and effective use of all their resources to attain the Millennium Development Goals. Josephine Wawera, GBS.